Hello, welcome to Storyline, where our mission is to understand human behavior and make that knowledge useful for everyone. My name's Christopher Gregg. I'm the CTO at Storyline Health and a co-founder. And I'm also an associate professor of neurobiology at the University of Utah, where my lab studies the genetic basis of behavior, health, and disease. When we talk about Storyline, it sounds very complicated. We're talking about algorithms and artificial intelligence and care pathways, and it sounds like it's complicated to use. It sounds like it might take a lot of time to learn it and use it. And I want to make it really clear that the software engineers at Storyline have done an incredible job. Storyline is super simple to use. You can literally build a care pathway or an AI assessment within a few minutes and deploy it at massive scale to thousands of people. Amazing. And just to remind you, the way Storyline works is you build these assessments. They're sent out to people's smartphones at scale. People answer questions in a kind of interview-like style through the smartphone. Their responses are video recorded, moved into the cloud in a HIPAA, GDPR, high-tech compliant, super safe ecosystem. And then within that ecosystem, we launch an AI microservices pipeline, and tens of thousands of measurements are made on those videos. In the video, we're analyzing things like pupil dilation, microexpressions, movements of the face, head movements, blood flow and perfusion patterns across the face. You can look at blinking rates, eye tracking, etc., etc., etc. So much data comes out of this. We look at speech as well, looking at what people say, what they're trying to express, how they're expressing it, the sentiment and emotion. And then it's not just what they say, but how they say it. And so there's an incredible amount of information in the vocal component, that audio component. And so we're looking at that as well, and we extract thousands and thousands of measures that give us a sense of the emotion in their voice, measure vocal microtremors, look at pitch and tone changes, stress in the voice, pronunciation, slurring, etc., stutters, whatever you can imagine, you can pretty much capture out of this rich behavioral data. And you can build care pathways that are step-by-step algorithms that work the patient through care or treatment experience in a very supportive and reproducible and effective way. And the AI intersects perfectly and organically into the construction of these precision care pathways, where everything begins with understanding the patient, giving the patient remote access to care, and to be able to measure and monitor their symptoms and behavior and needs. We then build these optimized care pathway algorithms that can be deployed to the patient to help to manage their care. This is accessible remotely. It's automated. It provides educational information, recipes, instructions, communications, reminders about when to take their pills, when to take bandages off, whatever you need to build and share and coach for the patient through. There's remote monitoring. Of course, that's a big advantage of the behavioral AI, is to be able to monitor the patient's well-being, quality of life, symptoms, etc. at scale and objectively and sensitively. And then all of this is safe to use. It's easy to use. It's easy to understand. And of course, it massively improves the care experience and the outcome of the patients. But it sounds complicated. It's not. It's so simple. And let me show you that. Okay, so I've gone to storyline.care, and I'm at the storyline.care landing page. And this is where if I'm a researcher or a clinician or staff member, I would log in to manage my Storyline account and build assessments or care pathways. So we can log in with Google, or we can log in with Facebook sign-ins, or with your own email and password. And as we enter into Storyline, the first thing that we see is the dashboard. And in the dashboard, there's a whole bunch of information that we're going to go through in a different video I'll just show some high-level things. You can see the contacts. So these are all the patients in this is my account, and there's over 2,000 different patients that I'm managing in this account. There's 28 different programs or care pathways or assessments that are live out there in the world, collecting data and being used by those patients, and different actions that people are taking, including messaging and sending out automated messages, text messages, emails, notifications, etc. The different programs that I have running are here. Different people in those programs are here, and I can watch as they progress through their pathways and figure out what they've finished and who hasn't finished different components, and search and communicate with those folks. So as I said, we'll get into that in more detail in another video. Here, I just want to show you how easy it is to get a program built and up and running right away. So over here on the left side of the page, we go straight into programs. We can add a program, click add a program, and we'll just call this program the Health Clinic Intro. So imagine there's some clinic out there called the Health Clinic, and this is an introductory assessment that patients that are going to come into the clinic are going to do. And so we'll call this the Health Clinic. That'll be the public title. So everything that I put over here is the patient's experience. They're going to see a picture. If I put a picture or a logo in here, they'll see that. The organization name, Health Clinic Inc. Just making that up. My name, my contact information, phone numbers, websites, other information that I want to add can all be displayed here. So that's the patient's initial experience, and then I want to just make a program right out of the gate. So one of the first things that I might do is go over to settings, and I can set up, first of all, a little custom message. Welcome to my program. You may be asked and answering questions via recorded video, so we want people to respond in a quiet, private space where they can concentrate. This is editable, so you can provide instructions however you see fit, but we've got some default things there. There's other important features that you can toggle on and off, like open story, links, which we're going to talk about here, and some other components that we're not going to get into here. Your consent form goes under the agreement. So if you're doing a study and your IRB has approved an e-consent form, you can just paste that consent form in here. We've already got a template for you, and people need to accept and agree to that consent before they can enter into the care pathway or the study or what have you. You can add evaluators, and these people are important, as we're going to talk about in a different video, for labeling data and evaluating data. You can rate and tag things, you can manage payments, and you can manage scheduling and other messaging things in here. Very powerful. So we'll just save that for now. And we will add our first component of our care pathway. That can be an action, it can be a session, or it can be a library component. So we'll start off with a session, and we'll call this the baseline assessment. This is something that we often do in our studies where before a patient begins a treatment or some kind of intervention, you want to do a baseline assessment of their current symptoms and behavior, cognitive functions, neurological functions, and things like that. And we'll just add a question right off the bat. We can just click and we add a video question. How are you feeling? What symptoms are bothering you? Okay, and that's just a very open-ended question, and it's going to go to their smartphone. They will read it, and then they'll be able to answer and respond to that question, and it'll be video recorded and moved up, and we analyze all of their responses using the AI. So we can set the time, give them 3 minutes to respond, or we could give them just 1 minute to respond to that. And we can allow the people to restart the question or not, depending on what we want in our study design. So there, right away, we've already made our first assessment. And, remember, Storyline's AI capabilities are going to measure thousands and thousands of things. And so even though that seems like a very generic question, we're going to get massive amounts of information around the pallor of the face, microexpression movements, how they articulate their answers, the stress in their voice, their emotional state, and more and more and more. So these video questions are incredibly important and incredibly information rich. And you can put lots of different types of video questions in here. For example, talk about your social interactions this week. Any feelings of loneliness? Set the timing. And you can start to essentially build a kind of psychiatric interview, but that process is going to become, or it's going to yield data that is sensitive, objective, and data-driven rather than the subjective, typical interview experience that one would have in the clinic. Now, the video questions are the most powerful, but we can also add in other more traditional type of questions that you might see in REDCap or Qualtrics or some other platform. All of those capabilities are here. You could have a selection question like, do you need to come in to the clinic? And they could answer yes or no, and that will appear on their phone as a yes or no button that they can click to select. There are rating questions. So if you wanted to do something like rate your pain today, which is a horrible question because it's so subjective, but so we could do 0 for no pain, 10 for extreme pain, and you could right away collect that data through the assessment. Now we can also provide, and this is really important, educational content. So we can upload a video, for example. We might have a video recorded, and it says something like, welcome to Dr. Greg's clinic. We're going to take really good care of you. We are specialists in breast cancer oncology, for example. And when you first check in, you're going to meet Lisa at the front desk, and then, I'll meet you in behind in the clinics, and we'll talk about whatever you're experiencing and what challenges you're going through, and we have the expertise to help you. So a video like that introduces the patient to you right off the bat, even before they've come into the clinic, and they have a sense of who you are. It can be, alleviating for their stress, and you start to build a relationship with them. So that becomes part of this care pathway experience. You can add drawing questions, which are, quite typical, for example, in a neurological assessment or a cognitive assessment, drawing clocks, drawing smiley faces. You can do association questions, which are very common in clinical psychology, where you might ask a patient to describe how this image makes you feel, and then you just upload the image or a video. The patient looks at that video, so it will be masked initially. They'll click a button, it'll be revealed, and there will be this kind of autonomic response that psychologists are very interested in using to measure things like sympathetic tone or emotional sensitivity and other phenotypes that are much more objective than, for example, questionnaires and patient-reported outcomes. Pupil dilation, things like that, and emotional responses can all be measured objectively using this association question strategy. Now, these capabilities allow you to build your own assessment and to invent and create and come up with new ideas to get at different phenotypes and subtype patients and build predictive models, etc. But you can also go into the Storyline library, which is a library of many, many different types of assessments. Some of these are, really well known. And so, for example, we can just type in here PHQ, and we can go through and just quickly grab the PHQ-9 questionnaire, which is a really well-established questionnaire for assessing depression symptoms. And we just click. Boom, the PHQ-9 is part of our care pathway. It'll be automatically scored when people do it, and it's ready to go. And there's other typical tools in that library that you might pull out and use. Now, at Storyline, of course, we don't love questionnaires. We make them available, but we're much more excited about video because it's so much more data rich. So you can go into Storyline and also identify video-based assessments that are incredibly powerful and useful. Here's one that is a neurological assessment. Essentially, a very rigorous neurological assessment that's based on a typical clinical neurological assessment that would be done face-to-face. But here, the questions like, puff out your cheeks, stick out your tongue, move your eyes, look to the right, look to the left, look up, look down. Those and, speech patterns and more, finger tapping for motor patterns, motor movements, motor learning. All of these sorts of things are assessed in this neurological assessment. It takes about 6 to 10 minutes. And rather than being this rather subjective experience where the clinician tries to evaluate whether there's an overt deficit, it becomes something very precise and quantitative because the AI is measuring each component very carefully, very sensitively. So boom, within seconds, I put together a little introductory baseline assessment that's going to gather a massive amount of data around how the patient's feeling. Do they feel like they need to come into the clinic, or, whatever that question might be. And then using clinically validated questionnaires and, deep assessments, deep phenotyping assessments, for example, of neurological function. Okay, so then we can say, that was great, all done. So they're done. And that was so easy to build that assessment and it's all ready for research. I can now run a new action and start to daisy chain together different actions, different assessments, and set up the timing and the scheduling for the whole process. So I could run this action immediately after the baseline assessment was completed, or I could run it after a few days. I could select a specific date that I want it to go, or I could set it as recurring. So they just keep getting it every week, every month, every 6 months. It's all automated and scalable. And I can set triggers so that it automatically begins right away, or when the previous session is started, or when complete. So I have some granular control over the experience that they're going to have. And then we just save that. Now, what do I want to do? I could add them to a new program. I could send them a message, send them a notification, send them an SMS message. I could adjust their status, which I'll see in the dashboard. So their status might say, look, they finished their baseline assessment. They're halfway through my program. And the other thing that I can do is I can run the AI analytics. And you'll see this in another video. But what Storyline does in the cloud when they run these AI measures is they build standardized data files that contain all of these measures. One of them is called Story Arc. The other one is called Story Time. And, unlike genome data or other types of data that are massive, behavior data has this dimension of time. So you may collect, in our case, over 20,000 different microfeature measures, but those also need to be oriented in time, and so that's what the story time file enables. And then screenplay is almost real-time metrics of thousands and thousands of features for deep phenotyping and research. So those can be run automatically by setting these as actions. So for example, I could select Run Story Arc and send a follow-up email to the patient. Thank you for doing your baseline assessment. And we just set this in so we can automatically select their first name. So it might be, hey, Chris, thanks for doing the assessment. I will have a look before our visit. To make sure you get the best care possible. Sincerely, Dr. Greg. And then I can kind of preview that message and see what it's going to look like. Go back. And now that's automated so that I don't need to think about that messaging. The patient knows that I'm going to be on top of this, and it just happens automatically after they finish their assessment. And I know that as a clinician, you're worried about the idea of having to analyze or look at thousands and thousands of measures of behavior, and that's going to be a different video where we make the experience of analyzing the data for the provider super simple and easy and helpful and useful. But that's a different video. This is all about how easy it is to build an assessment or a program. So we can then, if we want to, we could build a whole nother session that would be run after this or in 2 weeks. Let's say we want to run it after 14 days, and we can have it go at 10 a.m. so we have some control there on the timing, and we'll just have it run automatically, and that is all done. Let me just name it. We'll call this the follow-up assessment. Save. Okay, and then we can just build out a whole nother workflow here. Maybe do an association question, for example, or ask the same questions again to get longitudinal data. There's many options, and then we could set up some actions. If we want to do some reminders, we could send an SMS message. Don't forget to lower your dosage this week to 2 pills per day, for example, and that's automated. See how easy it is? In just a few minutes, you can use the Storyline library or these features or these different question types to just very quickly daisy chain a very robust assessment, layer in educational information and more, and deliver that to your patients. So how do we deliver it now? That's the next question. So first we activate this, run all scheduled assessments. So now it's live, and that means that patients can use it and access it. And we turn on the Open Story link like that and save that. And now this, if we just copy that link, we can send that link to the patient. We could put it on our web page, and anyone who clicks on that link, if they click on their smartphone, it will take them straight into the program on the Storyline app, and then they can do the assessment. Or if they don't have the app on their phone, it will take them to the Apple App Store, the Android Store, Google Play, and they can download it. It will step them through the whole process of downloading it and then entering into the program very, very easily. Another way to enroll patients that's useful, especially for clinical studies, if you have to consent people in person, for example, or you're trying to enroll somebody after a clinical visit, is to just make a QR code, and then when they're in the clinic, they just take a picture of that, and they are straight into the program. They got the app on their phone, they've got your care pathway or your assessment ready to go right out of the gate, and they just take a picture and off they go. And you can print that, hang it on the wall, show it to them in the clinic, whatever you want to do with it. And that's it. You have a massively scalable assessment that captures huge amounts of data to build objective models and do research, build care pathways, whatever you want to do with it. Super flexible, super creative, super cool. Thanks for watching.